Welcome to the Self-Rescuer training system. In front of you, there is a table with your self-rescuer. An arrow is pointing directly at it. When you are ready to take it, press the Continue button. Please remove your self-rescuer from the table. You can take it by hovering your hand onto the rescuer and then grabbing it. Be sure to only take. Now that you have taken your self-rescuer, let's have a look at the different items of the rescuer. First, let's look at the handle. The arrow points at the handle. Identify the handle of the self-rescuer by touching it. The purpose of the handle is to open the self-rescuer and to allow you to access the contents inside the rescuer. What is the purpose of the handle on the self-rescuer? To open the self-rescuer and reveal its contents. Before you wear the self-rescuer or start any shift, you must always inspect your self-rescuer for any damage or dirt. A broken or dirty rescuer could possibly malfunction and place you in a dangerous situation. Rotate the rescuer by using your hand and inspect the cover and exterior of the rescuer. Pay attention for any cracks or dirt. Is the self-rescuer in proper condition for duty? Now we will inspect the exterior indicator. If the exterior indicator is showing blue, it is fit for use. If the exterior indicator is showing pink, request a replacement. What color should the exterior indicator be to indicate that it is fit for use? Before going underground, you must attach the rescuer to your belt. Make sure that the unit is securely fastened and doesn't feel uncomfortable or bounce around on your hip. Before proceeding underground, is it necessary to place the self-rescuer onto your belt? When carbon monoxide, CO, readings exceed the OEL, occupational exposure level, of 100 ppm, the self-rescuers must be donned. At what ppm of occupational exposure level should you don the self-rescuer? When seeing, smelling or observing visible smoke, you should also wear your self-rescuer. Should you don the self-rescuer when seeing, smelling or observing visible smoke? When instructed to do so by another person, you should also don the self-rescuer. They likely know about a hazard that you don't know about yet. Should you don the self-rescuer when you are instructed to do so by another person? Where applicable, when a dedicated fire alarm is activated, you should don your self-rescuer. Should you don the self-rescuer if a dedicated fire alarm is activated? Now we will simulate a scenario where you would need to deploy your rescuer. Smoke has been detected and the self-rescuer has to be deployed. Swing the rescuer to the front of your body. Smoke has been detected. What should you do first? The reason we swing the rescuer to the front of the body is to be able to easily access the rescuer. It will be a lot harder to work with the rescuer on the side of your body. Why is it important to swing the self-rescuer to the front of the body? Next, go down to your knees to prevent the self-rescuer from potentially falling out of your hands and getting lost. If the unit falls from your hands, you may struggle to retrieve it in the smoke. What is the next step you must do to deploy the self-rescuer? While you are on your knees, open the unit by lifting up the lever on top of the unit. This will break both seals. The clamping strap and outer lid of the protective casing will fall away. While you are on your knees, what is the next step? How do you open the self-rescuer unit? Next, grasp the neck of the mouthpiece and apply a firm pull to jerk out the mouthpiece plug. Once the rescuer is open, what do you do next? While holding the hose with one hand, grasp the yellow tag with the other hand and pull firmly straight down. This is necessary to properly deploy the bag. While holding the hose with one hand, what should you do? Why is it necessary to firmly pull down the yellow tag? Hold the flanges of the mouthpiece and blow up the breathing bag by exhaling into it in order to start the chemical reaction which produces oxygen. This may take several breaths. After you have pulled the yellow tag, what's next? Why should you blow into the breathing bag 3 to 5 times? Insert the mouthpiece into your mouth so that it is positioned between the teeth and lips. Bite onto the mouthpiece lugs and close your lips tightly around the flange. Begin to breathe through your mouth immediately. When the bag is inflated, what do you do next? Squeeze the nipple on either side of the nose pads between the forefinger and thumb of each hand. This creates a suction. Pull the spring apart and position the nose clip behind each nostril on your nose, ensuring that when released the nose clip is firmly attached and will not allow you to breathe any contaminated air. Once you can breathe through your mouth, what is the next step? Why is it important to make sure that the mouthpiece and nose clip are correctly fitted? It is important to make sure that your rescue pack is securely fastened in the correct manner. Lift your hard hat and place it next to you. Once the nose clip is worn, what's next? Why is it important to make sure that your rescue pack is securely fastened in the correct manner? Fit the neck strap around your neck. With your hard hat placed next to you, what should you do next? Place your hard hat back onto your head to ensure your safety. After you've fitted the straps around your neck, what should you do? Is it important to put your hard hat back on? Tilt your head back to allow the strap to fit over your head. With your hard hat placed back on, what's next? Adjust the strap while tilting your head back. Is it necessary to adjust the strap while tilting your head back? Return your head to the normal position so that it creates a bend in the breathing tube. Once the straps are adjusted, what should you do? Wrap the waist strap which hangs from the bottom of the breathing bag around your waist. With a bend being created in the breathing tube, what's next? Clip the buckle and adjust it so that it is firm but not tight. Once the strap has wrapped around your waist, what is the next important step? Once you have fitted the straps securely, walk briskly in a calm manner to the nearest refuge bay. After all straps have been fitted securely, what should you do? At the rescue bay, close the door securely to make sure that smoke and dangerous gases do not enter the rescue bay. What is the first thing you should do when arriving at the refuge bay? Next, open the compressed air to allow adequate airflow and pressurize the bay. Once the refuge bay door is closed, what is the next step? With adequate airflow in the refuge bay, activate the air whistle signaling device. There is now adequate airflow in the refuge bay. What should you do next? If you are the most senior person in the bay, make sure you count the number of people present in the refuge bay and check for any injuries. What should the most senior person in the refuge bay do? Call the control room and give the operator the refuge bay number and ask him or her to phone back or radio to confirm communication. Should you call anyone from the refuge bay? When calling the control room, it is important to communicate your name and industry number, the amount of people in the refuge bay, and the refuge bay. What should you communicate with the control room when calling them? Only 1 out of every 10 cap lamps should be on in the refuge bay to preserve battery life. How many cap lamps should be on at any given time in the refuge? Finally, stay calm and await the arrival of the rescue team. What is the final task you should perform in the refuge bay?